I know them can go for. What the about line also? They go to my yellow and aka. And they can just stretch in one. Sir. To come and see us. They have come today to come and issue.
Executive of the Onicha Olona Foundation in Onicha Olona, an agrarian community in Onicha North local government area of Delta State, has purchased 100 health insurance premiums for its indigents under the auspices of the Indigent Enrollee Adoption Initiative of the Delta State Contributory Health Commission. The Director General of the Foundation, Mr. Anthony Chukwugozie Modongo, received the card from Dr. Isaac Akpoveta. The chairman of the governing board of the Delta State Contributory Health Commission, Dr. Austin Obidi, said the more agenda of Governor Sheriff Oborowori means more access to better health care to all Deltans. He said that in collaboration with the Hospital Management Board, the commission is dedicated to ensuring that enrollee satisfaction should be on the front burner.
It's auspicious we are here today in continuation of the more agenda of our governor, Right Honorable Sheriff Francis Orowedo Oborowori. The more agenda means more health benefits to Deltans. I'm privileged to be the immediate past chairman of the Hospitals Management Board, and I know we have a hospital here. But you see, it's one thing to register you. It's yet another thing to go to the hospital and get quality, timely, and efficient treatment. DG and I and the Commission, in conjunction with the Hospitals Management Board, we are completely agreed that enrollee satisfaction should be on the front burner.
Thank you.
What do I mean by that? You get to the hospitals, you get proper treatment, and we'll be having advocacy whereby we interact with one another to explain the running of our health insurance scheme.
Excited Dr. Akpoveta, who appreciated the magnanimity of the foundation for the addition of 100 persons to the scheme, has indeed helped the Commission in its strategies to extend the healthcare initiative to the local people. He told the foundation executives in the community that the scheme, which was initiated by former Governor Ifeanyi Okowa, is aimed at reaching all Deltans and by so doing save as many lives as possible. Dr. Akpoveta, in his speech, told the people that the Onicha Foundation has set a shining example for all other communities to follow by keying into the Indigent Enrollee Adoption Initiative of the Commission. He said the purchase of the health insurance premium for 100 community members was in response to the Commission's call for all people of goodwill to key into the initiative and rescue vulnerable members of the society.
Because what you have done is what God wants people to do. Look around you. Every family has somebody that is in need. Every family has a rich man. There's no family that doesn't have a rich person. And there's no family that doesn't have somebody who needs assistance. I talk line?
No, sir.
So when you look around your community, your families, and pick people that can't even pay 7,000 to look after their hair for a year, and you pay money on their behalf, it's one of the great things that God will do to bless you all. Amen. As we gather to celebrate the remarkable generosity and compassion of the Uganihu Umu Bekunu Foundation that has set a shining example for all to follow. The adoption and purchase of health insurance for 100 vulnerable individuals in your community in response to the clarion call of our commission to all people of goodwill to key into the indigent enrollee adoption initiative of the commission is not just an act of charity. It is a demonstration of profound empathy and a tangible commitment to the well-being of our people. The commission was signed into law on February 4th, 2016 by the former immediate past governor, Senator Dr. Onicha Olona, your son. This law was enacted to provide a financing, provision, and delivery of quality health care services in Delta State in our journey towards universal health coverage. This law underscores our commitment to ensuring that every resident has access to quality health care services without experiencing financial hazard of expensive health care. What does that mean? If you don't have this card and you are admitted in a hospital and they give you a bill of 550,000, I'm very sure the family may have to call a meeting and say, that plot of land along the express, we need to sell it so that we can pay this medical bill. That is pulling the family and the entire community into more poverty just because of one person that is sick. But with this card, you don't need to do that. The commission will pay. Please clap for that. As we gather here today, we embark on a journey towards ensuring that most vulnerable members of our society have access to quality healthcare services. This indigent enrollee adoption initiative is a testimony to our unwavering commitment to leaving no one behind in our pursuit of universal health coverage in Delta State. I would like to extend my warm health appreciation to His Excellency, the Governor of Delta State, Right Honorable Sheriff Oborewori, who has continued to give strong political will and financial support to this commission. And as you have seen today, the Indigent Enrollee Adoption Initiative underscores the importance of collaborative efforts in addressing healthcare disparities between people. Through this initiative, we aim to provide comprehensive healthcare to indigent individuals, thereby improving their health outcomes and promoting social equity within our society. I therefore urge all stakeholders present here today and beyond, especially those in diaspora. You have your sons in America. Please, instead of sending money for the burial of our people, let them send money to register people to take care so that they can live longer and live healthy. The Indigent Enrollee Adoption Initiative, pioneered by the Commission, aims to ensure that every resident, regardless of their socioeconomic status, has access to quality health care. It is heartening to see the spirit of solidarity and community support exemplified by this foundation, whose noble gesture will provide essential health care for those who need it most. With just 7,000 per person, you can purchase our health insurance card for your neighbor to access quality health care throughout the year. This is exactly what Uganishi Umu Gbekunu Foundation has just done, and the reason we are here today. Healthcare should not be a luxury reserved for the privileged few. It is a fundamental human right that must be guaranteed to all. By stepping forward to adopt enrollees and purchase health insurance for the vulnerable members of your community, this foundation has demonstrated a profound understanding of this principle and shown us the power of collective action in creating positive change. Today, as we witness the distribution of the health insurance cards to enrollees adoptees, I urge each and every one of us to be inspired by the selflessness and dedication of this foundation. Let us all take up the mantle of responsibility and join hands in supporting our fellow community members who are in need, whether through philanthropic initiatives, volunteering, or advocacy. There are countless ways in which we can contribute to well-being of those around us. Together, we can build a more inclusive and compassionate society where everyone has the opportunity to live a healthy and dignified life. Let us see this moment as a call for action, a reminder that our collective strength lies in our ability to care for one another and uplift those who are less fortunate. This is what the MORE agenda of the Oborevwori administration stands for. Think more and do more for your neighbor.
The Director General of the Onicha Foundation, Mr. Anthony Chukwugozie Modungo, stated that the plan of the foundation was to register 1,000 community members, but that the 100 persons registered is just a prelude and will be fulfilled following the expected impact on the 100 enrolled by the Commission. He commended the chairman of the board of Delta State Contributory Health Commission, Dr. Austin Obidi, the Director General, Dr. Isaac Apoveta, and his members of staff who abandoned the Easter celebration to visit Onicha Olona community for this program as a demonstration of commitment to their duty, adding that the people in the diaspora are ready to assist the less privileged in the community, noting that paying 7,000 naira for one person is less expensive than buying cows for burial ceremonies.
We are grateful that we didn't know that this smaller contribution we made to the organization would have moved the whole of the organization to this village. So it's a very pleasant surprise and have given us a greater confidence in the organizational ability of that institution. The chairman, the DG, and the directors and other management staff will forget about the celebration we are doing today. People are supposed to be on holidays and they are now working. That shows the commitment to this program. And we are very grateful. We are all debtors, and you are there representing us, ensuring that our health is assured. Because if you are not healthy, there's nothing you can do in life. And saving us the embarrassment, like you said, of selling our precious properties to rescue our dear one who is ailing is a very backward and dangerous operation. So we are grateful, very grateful. So immediately we saw this as we are coming in for our activities, which will go biannually, this foundation. We decided that we are going to key into this program. We started with 100 because we said, I don't know what it's all about. We don't know the details yet. We don't even know if our people will like it. But let's go and try these 100 people. If they come out with testimonies, obviously it will encourage us to enroll more people. And that is why we started with the 100. It's not that we won't have gone higher. And we are hoping that the experience of those who have registered will be pleasant so as to encourage the 1,000 enrollment that we expect. Our children locally and in diaspora are capable and willing to rescue the life of our people. Because buying cow for burials is not that cheap. Buying one cow can register so many people. So what is the point waiting for somebody to die for you to buy 10 cows to bury him when you can save him with just 7,000 naira per annum? So we are very grateful.
Other highlights of the outing was an award presentation by the Commission to the Foundation as ambassadors of the Commission and the reactions of the visible happy enrollees and other people in the community.
your card. So this card, with it, anytime you are not feeling fine, go to the hospital and they will give you treatment. If there's any challenge, report to us. We don't need a lawyer. We need ourselves to talk to ourselves. Yes.
I
will give you this card now. This card says you carry and go hospital. Anytime you're not well, carry and go hospital.
I am very, very happy, excited, exhilarated. Why? On a day like this, people are living out the essence of the scripture, loving their neighbor as themselves. And they are responding to a clarion call that people should adopt the vulnerable in their society. So I'm excited. This is grassroots. I'm privileged to have been the chairman of the supply side, that's the Hospitals Management Board, which bears a good proportion of the patients that come in. Their last tour, I toured with the Hospital Management Board, and we're in constant communication, leveraging on our relationship. That synergy, we want to ensure that there's enrollee satisfaction, so that we have satisfied customers. Pardon my language, the customer is king. The client is the king. We want to be sure that effective and efficient services are rendered in our hospitals. Our doctors and medical professionals are doing a good job, but for good job, you say more work. We beg them. As they see more people go in there and come out satisfied, they will go. We don't want anybody to suffer financial misfortune or pains as a result of spending out of their pockets. So we keep advocacy. The advocacy will continue. We do road shows, we meet with them, we explain to them, we do adverts, jingles, TV, print and electronic media. We speak to people to make them know that the way to go is health insurance.
I've been on the road, like you said, and that is very true. I mean, on the road, been on the road to ensure that Deltans, especially the vulnerable group of Deltans, are registered, enrolled into the Health Commission. It is vital that we get them enrolled. Nobody should be left behind. So every nook and corner of Delta State, in the far riverine area, in the hills, we will fish out those who have not registered and they so much need this health care. We will find them and we enroll them into the scheme. The new scheme, the initiative is referred to as Indigent Enrollee Adoption Initiative. Indigent people are people of need, people in their rural areas who need help. The premium of this insurance is just 7,000, but there are a lot of people there that cannot pay that 7,000. We have to find a way to get them to enroll into health insurance. So we've spoken to the philanthropy society, the high net worth individuals, organizations, foundations. We've been on this for some time, and I'm happy many foundations, individuals are now keyed into this initiative, and they are registering their indigents, the vulnerables among them, into the scheme. This is a very commendable thing done by the Gukwenu Foundation today, and that's why I'm far away inside Onicha North in the villages to inaugurate, to distribute the health cards and to ensure that health gets to everyone. More health gets to everyone, because health is wealth. We use a comparison to say this. National Health Insurance was inaugurated in 2005. By today, they've only covered 3 to 4% of Nigerians. This scheme was signed into law 2016, and by 2017, January 1st, we started enrolling. And by today, we have covered 30% of Deltans. Nothing can be more a sign of acceptability than that. They are accepting, and more are getting registered. I'm going to go to Ugele to flag off a 350 enrollees adopted by 2 sisters into the scheme. I've done that in Ibuzo, where 200 were registered. So it's growing very fast. People are very keen about getting health insurance because health is wealth, and they are very happy about it. We have assured them because continuously discussing with the service side of health insurance. But I must say there are challenges there. Many doctors, nurses, pharmacists of Nigerian extraction have departed to foreign lands looking for greener pastures. So there is shortage of staff in the hospitals. But we are negotiating, we are talking to ensure that a good care is given to them. And we do more about that. Don't worry. I'm assuring you that in the next few months, there will be a lot of improvement from the service side of this industry. We are going to assure that.
It will help me for my health.
Yes.
Anytime that I feel sick, I will use the card, go to general hospital, then they will treat me. Like malaria, like Onicha Olona here, malaria used to disturb. Even some of sickness, different sickness. But with this card, it will help. My prayer is say anywhere when they go, good things go to follow them. Long life, prosperity.
The inspiration came because they say number one, health is wealth. We want to make sure that everybody is as healthy as possible. We also know that there is so much lack and hardship in the country everywhere. And so people are finding it more difficult to go to the hospitals and collect good medical attention. So it's our intention here to make sure that as much as possible, rather than regarding or resorting to safe medication out of lack of money, people cannot go to the hospital with just this little, so-called amount of money. I think that's the motivation. Health is very, very important. If you have health, you have everything. And when you lose your health, you have lost everything.
With this, we are doing certain things to make sure that the generation following us will benefit more. Let them learn, because this movement, working after school, you just run out. It is disturbing. There is always a dislodge between what they think they are and what is happening at home. So on this issue, it took us time. But we said it would be bad. You are burying somebody with 3 million. We raise funds. But just simple treatment, maybe typhoid or so, no person cares. So we said we should key into this program and register as many as possible. Like you just had the DG said, we have money for another batch. We'll continue. Instead of us eating rice and other things to enjoy ourselves, I say kudos. That's God bless them and let them sustain it. The other things they can do too. So you are happy when you see your old man enjoying, well, because at specific times, ordinary 1,000 can be a stress, so serious stress on them, and they pass on.
It sweet me for body.
Okay.
I'm over happy. Well, I'm happy that we are, anytime that we are feel sick, we will go and collect free drug for general hospital. That is why I'm happy. Over.